October 13th, and we are live here at our Cambridge Tower. We're going to tell you all about that here in just a moment. Welcome into the Morning Medical Update. We're just really glad you're here. Hope everyone had a fantastic weekend. We're going to bring you to this beautiful space today. We're going to show you all around here. It is very special, and this is today where we are going to broadcast and share important news about the COVID variant and all things COVID related. We are streaming from the grand lobby of 3 new floors here at Cambridge that will open to patients this week. And this bed space has not come at a better time because COVID numbers continue to rise. And of course, we are seeing flu numbers start to rise as well. So we're going to head into the studio this morning and check in with Dr. Dana Hawkinson. Dr. Hawkinson, good morning to you. And can you update us on our numbers today?
Numbers, overall have stayed steady from what we've seen. Right now, today in the hospital, we have 36 active infections with 10 in the ICU and 7 on the ventilator. Of those 36 active infections, 2 are fully vaccinated. We still have 21 in that recovery period, so a total of 57. But however, we should state that over the past weekend, we did have 4 deaths. And our last death did come on the 12th. So, our numbers are steady, but that includes discharges, but also, unfortunately, deaths, and people are still dying from this.
Yeah, not good news. Thank you for the update, though, Dr. Hawkinson. I know you are joined with Alexis Delcid this morning inside the studio because she's going to be monitoring our community questions. So get those sent in. You can send those in via Facebook, YouTube. Of course, you can email those to the Medical News Network. Those links are right there on your screen, so start sending those in. But before I show you our space up here and introduce you to one of our great doctors and our guest today, any reporter questions on the line? We are good. Okay, so Dr. Hawkinson and Alexis, I'm going to get back to the studio with you in just a moment as folks start sending in those questions. But I want to kind of start to show you this space if we can. So while the pandemic put most of the health system's construction projects on hold, it could simply not stop this planned build out of floors 8, 9, and 10 inside Cambridge Tower. In fact, when the pandemic hit, construction was escalated to meet the high demand for patient beds. A $66 million gift by the Sunderland Foundation fueled the work that needed to be done. And I am sitting here all cozied up inside one of the lounge spaces that is inside the lobby when you walk in. So when patients and their families come in, they get to come into a room like this that looks nothing like a sterile hospital environment. In fact, they're welcomed in, and that's what all the spaces that we're going to show you today really are meant to do. They're supposed to kind of make patients and their families feel like they're at home. So I want to take you in here and show you the beautiful sunshine today and the gorgeous atrium and the chandelier and the view of Kansas City. It really is just an amazing space. And this is a 3-story atrium with this gorgeous chandelier and really the views of Kansas City that you can see from here. I stepped off the escalator when I first came up to this space. And when I stepped off, I literally gasped. And when somebody said the views up here were spectacular, I had really no idea what they were talking about. But you can see 180 views, 180-degree views of Kansas City when you are standing up here. So it is really remarkable. So this big, beautiful space. And one of our fabulous, amazing physicians, scientists, doctors, Dr. Joseph McGuirk. How are you this morning?
Doing very well. Thank
Good.
You
Have a seat. Let's sit down and visit a little bit.
You bet.
And I do have to look at my notes because this is a big space and you have a very big title that fits nicely into this space. Dr. Joseph McGuirk is the Division Director of Hematologic Malignancies and Cellular Therapeutics, as well as Medical Director of Blood and Marrow Transplant. So we're so glad to be with you today. And what does it feel to be sitting in this space this morning? I mean, the wait is over. We're going to welcome in patients and their families here in just a matter of days. And this is a project that you have been behind. How's it feel?
It feels spectacular, absolutely wonderful. This has been a vision for many people, the Sunderland family, me, our entire team, and most importantly, our patients and their families for years now. And it's come to fruition finally. We traveled around the nation looking at some of the best and most competitive transplant program inpatient units in the nation. We took from them what we thought was optimal, and we left the others behind, and we built a second to none in this nation stem cell and cell therapy transplant unit.
This is just gorgeous. You even said it feels like there should be a baby grand piano sitting
Yes,
here in this
right.
lobby.
Absolutely.
Play us a little tune. It is just, it's state of the art and it's gorgeous. And we're going to show you some of these images in a moment. But pandemic, as we know, has been challenging for everyone in some way or another, Dr. McGuirk. But for your patients in particular, what have some of those challenges been?
Well, all of our patients are profoundly immunocompromised. The most vulnerable population of patients that could possibly be dealing with COVID. They have virtually no ability to protect themselves against this, and they don't respond to vaccinations very well, particularly in the early post-transplant or post-cell therapy period. These are patients with blood cancers that attack their immune system. And so we have to treat the blood cancers, and in the process we destroy, at least temporarily, their immune system. And so they have to be in a protected environment. As you well know, this entire 100-bed, 3-floor unit has special filtrations, and it's quite a production just getting onto the unit to protect these patients and their families. Everyone has to go through an airlock and wash their hands. It's almost like a space unit.
It really is. They lock you in,
yes,
and
right.
you feel safe from the environment. So the whole idea is what you're describing is really trying to take some of those challenges away.
That's right.
So and these patients certainly these are not patients that their treatments could wait, even though there was a pandemic going on. I mean, you have to treat them no matter what, and very quickly in many cases.
Absolutely. All of our patients, without exception, are dealing with a life and death situation, life-threatening disorders that move very quickly, and if we don't take them to transplant, cell therapy, or treatment for a newly diagnosed acute leukemia, immediately we'll lose them in a matter of days to weeks. So time is of the essence. We can't wait on COVID. We never have been able to throughout this entire pandemic. We have to move forward.
So Dr. McGuirk, do you remember a patient by the name of Matt May?
Yes, of course. He's very dear to me.
Yes. Okay. So he received a marrow transplant at the very beginning of this pandemic. I remember visiting with him via Zoom. He was in his room and trying to communicate with his family. It was just a really weird time. He was 21 years old at the time. He's 23 and he's doing really well now, right?
Yes, very well.
But his family had to get really creative during this pandemic to show their love and support. So take a look.
Go, Matt! Go, Matt! Come on!
After 2 weeks isolated from friends and family, 22-year-old Matt May is going home.
It was really, really hard. I had some really tough days.
Matt was diagnosed with leukemia in 2017.
Just starting my second semester of college, so it was like just really starting to find my groove. I just got pretty sick, was in a lot of pain.
Matt's cancer came back just as COVID-19 was keeping other patients away to conserve medical supplies. But not Matt. He was rushed to the University of Kansas Cancer Center.
It was not a question at all of whether this was something that we could delay for any time period. We had to move quickly, and we did.
Matt's mom, Robin, has been physically by his side through it all.
My mom was my treatment plan. She handled everything.
But COVID-19 changed that too.
Not knowing if I could do this on my own.
In the time of COVID-19, keeping patients safe is priority one. That means getting creative if you want to see your loved ones.
Did you expect to see them outside your window? Did they tell you they were going to do that?
I had told them, I was like, there's a parking garage over there. Wouldn't that be funny? Blah, blah, blah. And my mom, being my mom, said, don't tempt me. I'll just sit out there in a lawn chair all day. We figured out how to still get those interactions and, fill each other up.
Immunocompromised patients like Matt and their families are experts at playing by the COVID-19 rules many of us are just now getting used to. Dr. McGuirk credits the nursing staff for keeping patients like Matt safe and connected.
They're there around the clock by their side and not replacing a family member, but keeping them linked into their family. It just really demonstrates the spirit of all of us when we work together as a team with family, friends, and our healthcare team to take care of our patients in great need.
I'm just so very thankful for the great care that he's gotten and for the blessings that God showered upon us. And then we get to go home.
And again, Matt is doing well, so we're so glad to hear that. Dr. McGuirk, patients like Matt have certainly taught all of us a lot of infection prevention rules that they, like we said, the package that they have been used to for quite a long time that people like us had to get used to because they're used to this. This is very routine for them, right, to be wearing masks and to stay isolated, unfortunately, right?
Yes, our patient population have been doing this for decades and going through the types of therapies that they receive, as I mentioned, that temporarily destroy their immune system. We have to rebuild that immune system. So they're very vulnerable, may not have an optimal response to a vaccination. So social distancing, making sure all family members, close contacts, care providers are vaccinated, critically important. Staying out of crowded areas and staying out of public spaces that are going to be crowded. And if they have to be out there to take these measures, goes a long way to keeping our patients safe. Despite that, we have had some of our patients develop COVID, and we've actually published and presented nationally and internationally the results. And our data reflect other centers throughout the nation in that if our patients acquire COVID and develop pneumonia, the mortality rate is almost 30%. So our patients can't afford that. Can you imagine having a life-threatening acute leukemia, beating the leukemia with a stem cell transplant or cell therapy, and then losing such a patient to a viral infection?
Can't imagine that. And so are these patients able to get their shots during treatments, or is there kind of a window that they have to wait out?
There's a window that they have to wait out several months before they get their first vaccinations.
So they have to be extra careful.
Everybody they and everybody in the family and anybody that they come into contact with, so critically important that all of those other folks are vaccinated to protect our patients. And we still have to advise them, unfortunately, to avoid hugs and kisses for months after transplant.
I know, and we saw that when we just saw Matt and his family, and they did not like being away from him. And that's kind of where I want to talk about this space, because it really allows family to be here close, but in the safest way possible, right?
Absolutely right. And this entire 100-bed unit, 3-floor bed unit, was designed around the patient-centric perspective and family perspective. So there are facilities to support the families here, dryers and washers and showering facilities, and they can stay in the room. It's really remarkable, and designed around our team so that doctors and nurses, social workers are not in isolated hallway offices, but in a single team center in the middle to facilitate communication.
So how was this space utilized during COVID? Because, you know, bed space capacity was at a max during many of those times. So how were we able to utilize this space while we were waiting to turn it into our transplant location? We were able to also accommodate other patients, correct?
That's right, exactly. One of the floors, the upper floor 10, was open to accommodate other patients, and general medical patients, for example, in the hospital while the rest of the unit was completed for the transplant patients. Now having moved the transplant patients and the acute leukemia, other blood cancer patients, and cell therapy patients over into this unit, that will all be completed tomorrow. That will open up other beds throughout our hospital system in our other units for those patients that we need to accommodate who have been waiting.
I feel like we were lucky to have that space, you know, to really accommodate during a pandemic. I mean, who would have
Yes.
known? And it just could not have come at a better
Absolutely.
time. So I do want to just talk a little bit more about, because we talked about 100 bed spaces.
That's correct.
There'll be 100 inpatient, 34 beds for cellular therapies, 34 for acute leukemia, 32 beds, 16 each for ICU medical and ICU hematology. So why do we separate, talk to us at how these all break down, and why do we separate the different cancer types?
The nursing staff, the laboratory staff, the physicians are all highly specialized, subspecialized in our university center, such that there are bone marrow transplant experts, cell therapy experts, CAR T cell therapy, for example, that's gotten a lot of national press. Acute leukemia is its own discipline. And then the ICU for those patients who are particularly vulnerable in a protected space, all of the air filtration systems that are in place that are quite elaborate, and the heme teaching service, which are other types of blood cancers. So it's broken apart by not only level of specialization of the entire team, but also by vulnerability to infection, so we can cohort these patients. So for example, the 10th floor, stem cell transplant and cell therapy, as you mentioned, the 9th floor, acute leukemia, and the 8th floor, the intensive care unit to house these patients when they become very, very ill. and then the teaching service for a variety of patients with different types of blood cancers.
I feel so lucky because I got to walk through and do this walkthrough before everything was set up and just get to know some of these areas. And I don't know if we have video of it, but tell us, there's like a command center. I mean, you talk about it. It's
Yes.
very like spaceship-like. You know, you come through the doors and you're locked in, and we're going to talk about the air filtration in just a moment. But you get in there and there's just so much going on behind the scenes, this command center, and then there's an actual lab where people are doing work that we would normally think would be behind the scenes, but it's kind of out in the open. You can walk by and see people doing this research firsthand.
Absolutely, that's exactly right. None of the therapies that we have today, although are fully optimized. Although we've saved a lot more lives now than we did 10 years ago and certainly 20 years ago, we still have a lot of work to do. That work is done through research, clinical research. And so we have a laboratory set up on the unit on the 10th floor, as mentioned, where we handle cells, thaw out cells that have been previously frozen in liquid nitrogen for infusion into our patients, collect samples, research samples on patients so we can learn new things about their cancers, about the therapies that we're offering to them. It's really state of the art. And as you mentioned, that command center is for physicians, nurses, social workers, discharge planners, the research personnel. It's really a model for the rest of the nation to follow.
It looks like the situation room. I feel like you guys walk in and you're all just, I envision you sitting at the head of the table and all of your partners around, really focusing on each and every patient every single morning and figuring out how to strategize and get these people well. Another cool thing apparently about this space is, I guess, the shades go down at a certain time of the morning.
Yes, it appears that they do.
Right? So it may block out our view a little bit and get a little dark in here, but that's just kind of part of it, trying to make a nice, comfortable space. I had the opportunity, as I mentioned, to tour here just last week, and we got to see inside the patient rooms. So I want to show that because they truly are beautiful, and they're open, and these big, huge windows, and all of these spaces that are dedicated to families and making them comfortable and feel like home. There's even a meditation room. What was the idea with that? I mean, how amazing is that?
You know, this is an extraordinarily stressful time for patients and their families, and having a space where they can go that is very quiet and peaceful and relaxing and allow them to just let go of it. In addition, the views around the city, as you mentioned already, are very different than some of the parking lots and brick walls and stucco walls that our patients were looking at directly out their window. This is a very uplifting space for patients, their families, and for our staff as well, and that is meaningful. We have a walking trail for patients to walk around the unit and see different perspectives on the city, and then different stations where they can stop, sit, and relax, like this space right here, throughout the entire unit. Very wide hallways so that people aren't bumping into each other and patients can freely move about the unit. Really, really very patient-centric, and so are the rooms so that they can control the shades from the bed. They don't have to wait for the nurse to come in to say, well, could you please open the shades? They can control that electronically right from their bed.
And really make that space their own.
Absolutely.
You all are really trying to make this the best in a really unfortunate time in their life, making it the best time that can possibly be and the most comfortable. We talked about the kitchen, shower space, laundry facilities, not just for the patients. This is for the families that get to come here and kind of semi-live here and move about the space as well. There's kitchenettes and big, long seating, eating tables where you can feel like you're having a family dinner, and families can just feel like this is kind of their home too, and they're nice and close by, right? That's
right. Our patients are here oftentimes for a month and a half, if things go well in the hospital. And so having those sorts of facilities are critically important for patients and their families.
Any special visitation rules?
Yes, a limited number of visitors. They all must check in with the nurse. They cannot come here with a cold, cough, sniffle. Their allergies acting up, which could be a viral infection disguised as an allergy acting up. We are very, very strict about patients coming in, obviously masking. They have to go through the airlock. They have to wash their hands meticulously, and there's actually a video to show them how to do that carefully. And when they go onto the unit, they cannot use the facilities of the patient. They can't use their restroom. They can't hug them. They can't use their telephone. All those restrictions are driving to the necessity of having family spaces outside of the unit for these folks.
Okay, so I want to talk about, before we get to community questions, and we're going to get to those in just a moment, but we're sitting without masks and we're sitting far apart. Of course, there's no patients here yet. They'll be here in a few days. But one thing that is really, really special here, and actually one of the most important features, if not the most important features, is the air handling system. Explain, we have video, I think, of actually what's going on up above us in the ceiling. Explain to folks what it is, what it's doing, and why it's so important to patients.
Absolutely. Even in a very clean environment, in a hospital environment, there's still a lot of particulate matter in the air. That particulate matter can collect bacteria, viruses, fungi, and patients can inhale that, get it into their lungs, develop a fungal pneumonia, for example. So a requirement by the national accrediting body for stem cell transplant programs and cell therapy programs is that there be a special air handling filtration system. Well, this is the top of air filtration systems. There's an entire floor up on the top of this building that just is dedicated to the air filtration. So the system will take out these microscopic particles and make this an incredibly clean and safe environment to prevent things like fungal infections, bacterial, viral infections. It's an enormous investment on the part of our institution, but critically important for the safety and well-being of our patients. And again, truly, and not to be too boastful, but there is no better in this nation than this unit you're sitting in right now.
Not boastful. I'm glad you mentioned that. And I'm breathing in this beautiful fresh air. It's so nice. But I think what you've said is true. We've brought these patients this far. We're not going to let bacteria and viruses, and we're going to keep COVID as far away from you as possible. We're not going to let any of those things get you.
Absolutely right.
So we're going to get to community questions, Alexis. I'm going to send it back to you. And let me explain something, because Dr. McGuirk, as you know, is very busy, and he needs to get to a couple of patients this morning. So if you have any questions for him, we're going to sit out here and have some coffee and kind of enjoy the view. But so if you have any questions for Dr. McGuirk, kind of. So send those out to us and we'll answer those. And then you and Dr. Hawkinson can get to some COVID questions, okay?
Got it. So for all our viewers watching, send those first if you have questions for Dr. McGuirk. In the meantime, we are getting so many questions about the Omicron variant. One of the big questions I got was from a couple, Jean and Byron. Jean writes, we're in our 70s. We are both fully vaccinated with boosters. Do we still need to go back to masking up in all places?
Yeah, I mean, I think it's very important to continue to do those non-pharmaceutical interventions like masking and distancing still. We know that you can be infected. You know, the vaccines will continue to provide, probably especially in those first 3 months, those first 120 days, protection against even infection itself. But we know more importantly, they are going to provide protection against that severe disease and hospitalization. But you still want to continue to do those things as far as understanding those situations that you're in, the risks that are taken in those situations, and continue to do the masking, the distancing, obviously the hand hygiene all the time. When you feel unsafe or feel like you want to continue to reduce your risk. Remember, it's not all or nothing. There are levels and steps in that Swiss cheese model, and certainly if you can do more and more of those things, you are going to protect yourself as much as possible.
Would you still recommend, Dr. Hawkinson, that kids in schools wear masks?
Yeah, I think that is very smart. You know, we know that a majority, when masking was occurring, a majority of the cases in the schools were occurring outside. But now as we are getting into the holiday seasons and we know that influenza is there as well, I think masking is going to continue to be very important to keep kids, number one, well, but also keep them in school so they don't have to quarantine or be out of school because they've been exposed. I think that in those schools that are able to make those rules, I think masking right now is the best way to go.
Carrie Linson has a question. She writes, I'm curious about the spread and severity of Omicron compared to Delta.
Yeah, I don't think we really know and understand that. You know, we've certainly heard that it is, quote unquote, more transmissible, Omicron is, than Delta. It's really unclear exactly what that means. We know that there are some properties of Delta that make it a lot easier to infect, such as it having, you know, more RNA in there. It can maybe reproduce more viral particles so that you express those out into the environment. It's really hard to understand exactly what makes Omicron more fit or better to outcompete, say, Delta in any environment that it's in. But we are still learning those questions as far as does it cause more mild severity? I think that's really difficult to answer right now. If you have to remember, there is some vaccination. We also know that in South Africa, a large amount of those people were already infected with Delta. So is that offering some immune protective effect as well? So I think those questions are not fully answered. But what we do know, and we heard Dr. Fauci say last week and today, that the vaccines continue to provide good protection, especially if you've gotten your booster. So if you haven't gotten that additional dosing, please go get that additional dosing. That will continue to offer protection against your risk of hospitalization and significantly reduce that risk of hospitalization.
Viewer Matthew Greenlee emailed us. Now, it's a long email, so I'm going to paraphrase it. And he also thanks you for all the knowledge there. They watch all the time, he and his wife, and they really rely on this program to get their information. He writes, Matthew writes, my wife and I are both vaccinated. She has gotten the booster. I have not gotten the booster. My wife is 34 weeks pregnant and tested positive for COVID last Tuesday. I have not had any symptoms. I received a negative test last Friday. When is it safe? He has two questions. When is it safe for us to be around each other without masks and go back to sleeping in the same room? And should either of us get tested again?
You know, the current recommendations is that if you're vaccinated, you probably, you don't really have to quarantine yourself necessarily. Just be on the lookout for any symptoms that may occur. If you start feeling differently than you had been, especially after that known exposure, you should probably go get tested. We recommend anywhere from 5 to 7 days, probably on that 7 days, so that you're really going to have the optimal chance at being positive if you truly are positive. Still, I think the other rules remain the same as well. If you have an active infection, it's really being isolated for those 10 days from when the symptoms started. And at that point, you should really be okay to go ahead and do your normal routine and get back together in bed, have dinners, whatever, spend time together. But it's also important for you to go get your booster now. You certainly can wait to see if you have the infection. If you wanted to wait a week or two, that's reasonable as well.
We have so many more questions to get to. We do want to toss things back out to Jess and Dr. McGuirk, though, because Dr. McGuirk has to get to tending to his patients.
He does, and I'm going to sneak in a couple quick questions, though. Dr. McGuirk, what kind of role does stress play in lowering someone's immune system? Deb wants to know.
That's a really important question, and it's a complex question, but very simply, stress certainly impacts the immune system and in a negative way. We know that from many different studies. There are interactions between the neurological system, including the brain, all of our nerve endings, and immune cells. There's a lot of crosstalk that goes on there. And so creating an environment like this that is uplifting and a healing environment is important. We come back to the meditation room and being able to decompress, to have an environment in a room where you can look out at the world and see the city and remember why you're putting yourself through all of this after all, and to accommodate family members and take some of that stress away. It all goes to creating this healing environment and improving outcomes for our patients.
Because we have so much stress out here trying to get through these doors and into our spaces. So it's really nice to know that there's a place that they can come to try to keep that stress away, because sometimes it's easier said than done.
It's a sanctuary.
It is. It is. Just last question, if there was any confusion, Isaac was curious about, we talked a lot about proton beam therapy and our facility that we built for that, the Proton Center, and then of course here, our blood and marrow transplant level, and explain the difference. And these are two separate spaces.
Yes.
But if people hear that, they might, you could maybe better explain that to them.
They certainly are two separate spaces. The Proton facility requires its own building, its own space, which has just been recently completed, as you all have reported on, and is state-of-the-art as well. It's on this campus, but it's removed from this building.
Equally important in helping patients as we are here. We will be joined by patients this week. Again, just how does it feel to know that we're going to be welcoming them into this space?
It's somewhat surreal. This is the top of my own personal career to see this happen for patients and their families, and for our staff, our team members, for our institution and for our community, all of whom were required to make this happen.
I love to hear that this is a big milestone for you, a career milestone.
Oh, it is. It's the top.
So I feel honored to sit here with you this morning. I brought you coffee, and you said, "Oh, Jessica, I don't drink coffee." I said, "How do you not drink coffee?" But you said you do. You drink a lot of really fully leaded tea every morning to keep you going.
Absolutely. Irish breakfast tea.
Okay,
Yes.
all right. Well, I hope you've had plenty, because I know you've got a big day ahead of you and you've got a couple of patients waiting. So we don't want to hold you back. We're going to let you go, and we appreciate you.
Thank you so much.
Thank-
Appreciate you and everyone who's helped us get to this point.
You bet. Have a great day. Alexis, back to you in the
Thank you.
studio.
So Jess is going to be over caffeinated today.
Yeah.
She's got double dose of coffee. All right, thank you, Jess. Thanks to Dr. McGuirk. Question from Joyce Morrison. Joyce would like to know from Dr. Hawk, what are your thoughts on the exciting news with the EUA approval of AstraZeneca's EvuShield, as I hope I'm saying that right, as a pre-exposure prophylaxis for COVID for those immunocompromised? Dr. Hawkinson, you're going to have to also simplify the question, because a lot of us are not familiar with prophylactic and all that stuff. So explain what that is and what she's talking about.
Yeah, so the AstraZeneca product, EvuShield as it's pronounced, is a combination of 2 monoclonal antibodies that are given in separate injections at the same time. And what it is due to help is for that pre-exposure prophylaxis, especially for those immune-compromised people, those people that may not have had optimal responses to the vaccine. So if you are one of Dr. McGuirk's patients, for instance, or if you've had a solid organ transplant and are on immunosuppression, or if you're on immunosuppression for other reasons, you would meet that criteria for getting this this shot, and this dose can more than likely be given in the clinics. I know that we are preparing, once we are able to get the supply, to be able to dispense it in the clinics themselves. But again, this is in no way a substitute for vaccination. You still need your vaccination. This will help provide further protection for you, though, with those monoclonal antibodies. And from what I've been reading from AstraZeneca, at this point in time, their initial studies look like the monoclonal antibodies still provide protection against Omicron variant, even though there are, over 30 of those changes or amino acid substitutions within that spike protein. So if you are immunocompromised, please talk with your medical team about the possibility of getting the new product from AstraZeneca once it is available to help protect you against severe disease and death should you be exposed to SARS-CoV-2, but again, it is not a substitute for vaccination.
Is that something, just to clarify, is the prophylaxis something that you take once you know that you've been exposed, or is it something where you go get your vaccine and your booster and then you go ahead and get that extra prophylaxis medication no matter what?
So for the other monoclonal antibodies, we know, and I think it's Regeneron does have an EUA, I believe, for post-exposure prophylaxis, so you know if you have been exposed to somebody who had it, say like the earlier gentleman with his wife who was recently infected and he could possibly go get it. Again, it's not for everybody. In this case, with the AstraZeneca product, it is for pre-exposure. So before you even know you've been exposed, it is a prophylactic measure to help if you are exposed so you don't develop severe disease and illness.
Kathy Wooldridge has a question, and it's an interesting one. She writes, my niece's family lives in Independence, and they're all just getting over COVID. She says her 16-year-old can't do flu or COVID vaccinations, and she's heard the rest of the family could take them, but would have to be quarantined because of vaccine shedding. Is that a thing? Is that myth?
No.
What is that?
No, this is another misinformation campaign. I don't really know. There's no truth or scientific evidence to vaccine shedding. Again, once you get these vaccines, and especially if we're talking about the mRNA platform vaccines, all of the interactions that are taking place, that immune response is really taking place within those lymph nodes, and those lymph nodes that are close to your shoulder, so that would be in your axillary or armpit area. That is where a majority of those immune responses are taking place. There's nothing to really shed. Again, you make the spike vaccine from the modified RNA. A lot of that information and response is taking place within those local lymph nodes. So there is no truth or evidence to vaccine shedding at all. We know that you don't get the disease from the vaccine. We know that you can't shed COVID or SARS-CoV-2 from the vaccine. So this is just one more piece of misinformation.
Deb has a question. Deb Pelicano has a question about at-home rapid tests. Missed kits come with 2 tests.
Yeah.
You do one, and then 36 to several days later, you do the second. If your symptoms are mild and both tests come out negative, is that PCR still necessary?
You know, I think it just goes to really how sure do you want to be. Unfortunately, now we know that there are other common cough and cold viruses going around, especially those 4 common coronaviruses that we've known about that just cause the common cold. We know there's rhinovirus, metapneumovirus, and especially also now we know there's a lot of influenza virus around also. So I think it just kind of boils down to how safe you do feel, and how safe do you feel with, number one, your ability to get a good sample when you're doing that test. But certainly if you're symptomatic, also understand, are there other people that you've been around that you know are symptomatic? Have they had a diagnosis, a specific diagnosis, say of COVID or of influenza? And so I think you just have to take all of that into account. If you still don't feel safe or know that you'll be meeting with certain groups of people, say at-risk people, elderly, and what have you, then certainly you can always go get that confirmatory PCR. But you know, those 2 negative antigen tests with everything else going around, it may give you some more confidence that that was a true negative result. It's just always, you know, not going to be 100%, but it will help.
Denise wants to know, is the booster from Moderna effective at all against Omicron? And what about the other vaccines?
Yeah, I think what we have seen, and this is the great thing of our ability to have had this science and develop these vaccines, is that they have shown protection. Now, some of the antibody protection may go away, but we do understand that when you do get that additional dose of Pfizer or Moderna, you have an increase in your overall antibodies. We know that when it is a certain time period from that initial series, whether it's 6 or 8 months, we know that you have continued evolution of your immune response to help widen that breadth of those antibodies that could react to those variants of concern, ones that we know about and ones that we don't know about. But what we do know, and the earliest data does continue to suggest that you have good protection, especially against severe disease and hospitalization with the current mRNA vaccines. But again, we are still trying to get those questions fully answered. But the initial reports are that we still get protection from the current vaccines.
When it comes to Omicron, Sandy has a question. She wants to know, what are the common symptoms that you're seeing with the new variant? Yeah,
I mean, again, I don't think that we've identified Omicron in Kansas yet. I have to believe it's here just because it is. We've seen that it is able to spread geographically fairly quickly with a plane flight or a car trip. It's easy for somebody to have it and spread it. We haven't necessarily seen that. We wouldn't know that we necessarily have seen it here at the health system. A lot of the sequencing, again, is done at the state level. But I think really the disease process is going to be the same. You're going to have the same types of symptoms. Again, is it less severe or is it more mild than Delta or Alpha or any of the other variants? It's really difficult to tell from the early reports, again, because if you look at South Africa, they don't have a lot of vaccination there. They've had a lot of infections, especially with Delta and some of the other variants. And so is it more mild? Do they think they're not seeing as much disease in the hospital? Although from what I do understand, their hospitals are close to capacity as well. And so those clinical questions are still not fully answered. But hopefully we will continue to get information soon. And we know, I think a lot of people will be looking to Israel. We know the Israeli data from the beginning has been very good because of their countrywide plan to vaccinate as many people as possible and to get the ability to get that good population data as well.
Question about booster shots. This is from Angela. Angela wants to know if she should wait 6 months after her booster and get a 4th booster. What's the deal with a booster for the booster? Is that going to be recommended?
I don't think we have that information right now. We are still considering full vaccination as 2 doses. Will that change in the near future? There's a possibility it could, but right now I still believe it is too early. We don't have any of that information on if you will need a 4th dose. I think we still have to look for that. And again, at this point in time, we're talking about the immunocompetent people, not the immunosuppressed people. So on those immunosuppressed people, they should obviously get that third dose and then that fourth dose after. But for the non-immunosuppressed, we just don't have that answer. And I think if you look during that time, we're also going to have to understand all the dynamics that are taking place of those people that do get the infection even after their third dose or their booster dose. Is that going to be now some sort of natural boost in immunity as well? And so I think all of these things over the next few months, we are going to get better answers, but we don't have answers to those yet.
But as of now, you couldn't just, correct me if I'm wrong, you couldn't just walk into a CVS and ask for a fourth shot, right? Or are they giving
Correct. Under recommendations and emergency use authorization, you could not go ask for a fourth dose. However, we do understand that people aren't always honest, and we do understand that there is a large supply of vaccines within our country. And so I think you can still walk into a commercial pharmacy, for instance, or your physician's office if they aren't really aware of how many doses you've gotten. But again, right now there's no recommendation to do that. Right now we know that you still are provided great protection from just that third dose.
We have a question from Sharon out of Greene County about swabs, PCR test. Mm-hmm. Sharon writes, the health department in Greene County is doing throat swabs. They say they're PCR, but I thought PCR tests were done in the nose.
Yeah, there are different tests. Certainly we know that the best rates of sensitivity and specificity do come with those NP or nasopharyngeal swabs. And so you'd really have to ask the person who's doing the test, but also what platform or what company are they using, because that can have a difference as well. And remember, all of these companies, all of these certain technological platforms, they all have different rates of sensitivity, specificity, how well those tests detect actual true cases, and how well they don't detect actual false cases. And so a lot of that can be specific for the actual company or technological platform as well.
One more question, and then I think we're going to go back out to Jess, who has some really cool things to show us. This is from June. June would like to know, how common is it to see deaths or severe illness in fully vaccinated people who are also boosted?
Yeah, it is really uncommon. We know that the majority of cases and hospitalizations that are occurring in the United States are occurring in those unvaccinated people. And we also have, maybe today or tomorrow, we get up a graph showing that actually a majority of the cases, 90% or more, are occurring within those people that are not vaccinated. And so I think that is good evidence to show that vaccination really is working and continues to work. But it does happen. We know that it does happen, especially older age, other comorbidities, and of course immunosuppression. All of that plays a role into death or severe illness, even with vaccination. But the vast majority of the people that are hospitalized and die continue to be unvaccinated.
Dr. Hawkinson, we want to take a pause here and toss it back to Jess, who is standing by, and she's ready to take us on a little tour. Jessica.
I am. So, Alexis, out these windows right here, this is where Dr. McGuirk and I were sitting. So I came inside here. You have to wait for the door to close. This is where we're talking about this air lock system. So I'm going to push this button because it turned green, and we're going to walk back here. So let's go on a little field trip since we got a little extra time. So walk down here with me. I know it kind of looks like a regular clinical space, but and there's rooms off here to the side. But I'm going to just show you, let's see what's going on down here. Now, I want to show you the walking trail, first of all. See this trail with these little peaks? You see those peaks? What this helps is for caretakers to maybe tell a patient, hey, try to walk to one peak today, or try to make it to 2 peaks today. How to see their progress. And then okay.
Oh, nuts. So, that is so cool. Looks like her shot is cutting in and really out. Cool.
Yeah. Can you guys see us?
We can see you, sort of. It's going in and out. I just love the part about setting those goals for the people to walk to the peaks. And Jess had said it looks like a clinical setting, but it also looks different. It does look more peaceful and serene with the artwork and things. As soon as we get Jess's shot back, we want to go right back out there because there are so many cool things to show you. But I also have some questions in the meantime. So if you don't mind, we have more COVID questions. Donna would like to know, this is an interesting one. Are we still worried about a super virus of flu and COVID?
I'm not sure what that means. Or are you talking about the viruses combining their genome and their properties? I don't know that there's a lot of discussion about that. Certainly, we are concerned about a twindemic, though.
I think that's what Donna's talking about.
Okay.
Because about a year ago, we were talking about twindemic. So I don't think she meant necessarily a super virus, but go on.
Yeah, I mean, I think we're certainly concerned about both viruses circulating at high rates and causing those infections. We know that the influenza cases are going up around the nation and around our community, so I think it is very important. We know the ways that will help reduce illness and overall severity of illness from influenza, and that is vaccination. Please go get vaccinated if you haven't yet. But it's also those other things, and we had a question about, should I still be masking if I go indoors and places like that? We know that the masking will help reduce your expression of any viral particles out into the environment, whether you have influenza, a common cold, or COVID-19. We know that wearing the mask will also provide you protection as well. And so I think we are more concerned this year right now, if we look back a year ago from now, about influenza and COVID-19 infection, because we are seeing them both at higher rates right now. Luckily, we aren't seeing a lot of hospitalization from influenza, but once it starts to hit those at-risk populations, we certainly could.
I have a question from Dan who wants to know if the cases you're seeing are purely Delta now.
I would still assume that they are. My last check on the circulating variants within the country, but also locally. Usually I go to covariance.org. Really continues to be all Delta. And we haven't really heard of any Omicron in Kansas, although I would have to expect it's here. But as we are continuing to do quite a few, I think it's at least a few hundred sequences a week, we should be able to find it. And I haven't heard anything about the wastewater and if they detected Omicron in the wastewater just yet as well. But right now we continue to assume that it is all Delta. However, clinically, it really doesn't make a difference. We are still going to treat you as if we would treat any other variant of concern, and that's if you meet the criteria: remdesivir, steroids, blood thinner, and certainly if you meet the criteria for some of the other adjunct therapies like baricitinib or tocilizumab. If you are that ill that you have to go to the ICU, we would use that as well.
We're getting some really fantastic questions from loyal viewers, and keep those questions coming, because if we didn't get them today, we're going to save them and continue asking your questions for you tomorrow and in future broadcasts. Dr. Hawkinson, what are your final thoughts this morning?
Yeah, so again, we talked about the twindemic. We know influenza rates are going up. We know the COVID-19 rates are going up. But we know ways to protect you individually and your community for having that reduced risk of hospitalization, that reduced risk of severe disease, and it is continuing to vaccinate. If you haven't gotten any doses of vaccine, please go get vaccinated. If you meet that criteria for that booster, please go get that additional dosing and that booster dosing. That is important. You still have time. You will get immunity from the booster or the influenza vaccine right now and help, again, protect you and your bubble and your loved ones as much as possible. Vaccination is the way to go. And I'd also like to say happy birthday to my son. He's 15 today, freshman at Rocker, so I know that they are doing some finals this week, and they have generally done a very good job of keeping their students safe. Hopefully everybody can get out of this finals week and everybody can be safe. So.
Oh, happy birthday to your boy, not your little boy anymore.
No.
Thanks for being with us today. We want to check back in with Jess, who's going to wrap things up for us. Jessica.
Alexis. Again, thanks so much for tag teaming this with me today so I could show off this beautiful space. And where I left you off was this walking trail that goes all the way around. And I just really want to show you kind of what people can experience. I mean, not very often you see these beautiful views and you can walk by and get that sunshine coming in on your face, and you can look out the window and get 180-degree views of downtown. I think I can even see a little bit of the plaza area peeking out over there. So it's just so beautiful, and we're just so glad that we're going to be welcoming patients back this week. Tomorrow, we have a couple of guests on that were so great that we've had to invite them back. You can add zoo animals to the list of those eligible for the COVID vaccine. They too are contracting COVID, and the virus has now been detected in wildlife like white-tailed deer. How does this affect hunters out there, and how will it affect somebody who might eat the meat of a possibly infected animal? We've brought our zoo and animal experts back, so they will be here to answer all of that and many other questions that you have. So please join us tomorrow. Make it a great Monday. We'll see you at 8.
Subscribe to our morning medical update and open mics with Dr. Stites podcasts. Now everywhere podcasts are available.